Hi, I'm Michael Lauder, and one of the things we're going to talk about today is the importance of dentistry, not just in horses, which is my area of expertise, but also in all animals. I have been fortunate to work on everything from elephants to rats, and if you have an animal at home, whether it be a dog or cat, anything that has teeth, it needs to have an examination by your local veterinarian. But horses are just a great example of how dentistry is so important. And if you go back and look through history, you know, a horse's lifespan was 4 or 5 years of age. And now through all different things, deworming, nutrition, better dental care, horses are now living in their 30s. It's just some basic things that we need to keep in mind. All horses have teeth. All horses are going to have a dental problem at some point in time in their life. Now, one of the things we need to think about is when that horse is about a year of age and your veterinarian comes out to do the yearly examinations, you want to have them look at the horse's dentition. Now, if you've got halter horses at home and you're worried about getting that perfect halter filly or colt in there, be sure you look at that foal's teeth when it's just a few months of age, because if there is a dentition problem, an overbite, an underbite, we will have our best chance of correcting those problems at that young age. Between the time a horse is a year of age and 5 years of age, they will lose 24 baby teeth and have the potential to pick up 36 permanent teeth. This is also the time when all the training is going on. We're trying to teach them how to do everything we want them to do and to be the world's best. We'll take those horses and we'll look at them every 6 months and make sure they've got the best opportunity for their teeth to erupt correctly. Because what we do now is going to influence our horse 15 and 20 years down the road. So once we get through this first 5 years, now people want to know, how often do I need to have my horse's teeth looked at? Once a year, you need to have an examination done by your veterinarian. When we look in those mouths, we're looking for teeth that are shedding, we're looking for sharp enamel points, and things of that nature that we can fix to make this horse work better and perform. And the best opportunity for doing that is making sure that their dentition is right and that their bit fits properly in their mouth. Each horse has a unique mouth, and what we've done at the University of Georgia now, we've gone through and we have a way of measuring the horse's palate. And when we look at that palate, we can determine the depth of that palate. And that's going to help us decide what type of bit this horse needs. Now recently, and we have a national champion equestrian team here at the University of Georgia, one of our horses just wasn't performing up to its normal standards, and they asked us to take a look at him. Well, one of the things you're going to see from the x-ray behind this is that this horse has a fractured tooth that no one noticed, and he was still eating. And probably one of the biggest things that I see people tell me, well, he's not losing weight. Well, no, a lot of times they don't start losing weight until they're in dire straits. So if you have a horse that's performing and it's been doing great, it's been running the barrels, you know, you're up leading the state, and then all of a sudden your horse is not wanting to go around that first barrel or that second barrel, and they're pulling on the bit, and you've got a gag bit, you tried a couple different things and it's not working. Well, one of the things you want to do then is get someone to look in that horse's mouth. Now we're going to take a look, and I'm going to show you just a few things on a couple of skulls we got down here. This is obviously a skull from a very young horse and a much older horse. What I want you to look at in this skull is this young horse only has 3 teeth, and they're not going to be near as sharp as an older horse. But now when we take this top part of this skull off here and look at this older horse, you can see all the teeth here. Now the other thing that you'll notice on this horse is you see this, how the front part of this tooth here is elevated, and this horse has a ramp, and when your teeth are not level like this, it interferes with the ability of that mandible to move forward or back. So one of the things you want to make sure you're getting done on these performance horses is that they're being evaluated by someone who takes an interest in dentistry and is willing to take the time and give your horse a good checkout. Now, when this checkup comes, you want to make sure that you bring your bit. Let the veterinarian see what kind of bit you're using. This is a happy mouth, just straight D ring snaffle, but you can see this bit's been chewed up all there toward the center, which tells me a couple of things. That the horse had to be pulling the bit way over to the side of its mouth, or the rider was pulling the bit way over. And the horse was grabbing a hold of this bit and biting significantly hard on it to break this up, in the stance that something was wrong. And this horse was trying to tell the owner. Run your thumb and forefinger over your bit, make sure it's nice and smooth, and for any reason it's not, then start thinking about reevaluating the bit that you have in the horse's mouth. When we have a horse that has a diseased tooth, we can extract that tooth, in most cases orally, without ever having to do the general anesthesia that a lot of horses have to undergo. And in most cases, we can get the tooth out through the mouth, and we've saved the horse from going under general anesthesia. Most of these horses can be ridden the next day.